This really pisses a lot of people off because a lot of people think that this gives addicts and alcoholics an excuse, that they don't have to be responsible. Alcoholism, drug addiction is in fact a mental illness. Hello, my name's Ken Seal and welcome to Let's Talk Addiction. So, we're going to begin these videos with a discussion of what exactly a disease is and what addiction is. And basically what the American Medical Association and the American Psychological Association say is that alcoholism, drug addiction is in fact a disease. Now, this really pisses a lot of people off because a lot of people think that this gives addicts and alcoholics an excuse, that they don't have to be responsible. But in fact, if you look at the definition of what a disease is, you'll see that alcoholism, drug addiction is in fact a disease. So, what is a disease? Well, a disease is defined by three different things. First of all, it's chronic. It comes and it stays. It's not like a cold. A cold is acute. It comes and goes. So it's chronic. It comes and stays. It is progressive. It'll continue to get worse and worse if nothing is done. And finally, it's deadly. Okay, so chronic, progressive, and deadly. So, diabetes. Is diabetes chronic? Of course it is. Is it progressive? Yes. If you don't do anything to stop it or slow it down, it will get worse. And in fact, it will kill you if nothing is done. How about cancer? Of course, cancer is chronic, it is progressive, and it is deadly. So, alcoholism, drug addiction. And let me just be clear on one thing right now. I really get tired of having to say alcohol and drugs because in fact, they're the same thing. You know, I don't know how many times somebody says to me, well, at least I don't do drugs, I just drink alcohol. I don't know how to tell you this, boys and girls, alcohol is a drug, okay? Basically, alcohol and drugs are mind-altering substances. And that's how I'd like to refer to them, although I keep going back to alcohol and drugs all the time. But the point is, they are mind-altering substances. So is a Hershey bar, okay? And if any of those mind-altering substances are abused, it's going to cause you trouble, okay? So let's get back to a disease. Alcoholism, drug addiction. Is it chronic? Yes, it is. It comes and it will stay. If you're truly addicted, it comes and stays. Is it progressive? Yes, it is. If you're truly addicted, it will stay with you and it will continue to get worse and worse and worse until it basically takes over your life. And is it deadly? Yes. You know, I've been doing this for a long time, and unfortunately, I've gone to lots of funerals for people who never got control of their addictions. It is very deadly. All right? So it is, in fact, a disease. Now, what I want to do next is I want to just discuss with you what the doctors and the therapists and the psychologists, how do they figure out whether or not somebody has the disease of addiction? Well, they have this little manual. It's called the DSM-5, Diagnostic Statistical Manual, and it lists all of the psychological illnesses in this book, okay? Alcoholism, drug addiction is in fact a mental illness. And what I'm going to do is I've got this list, and these are 11 questions that are in the DSM-5 that a therapist, a counselor, a doctor, psychiatrist, psychologist would ask somebody to determine if in fact they have addiction issues and at what level, okay? Now, I'm going to read these, so here's what you need to do right now. You might want to put me on pause, go off and get a piece of paper and a writing stick, and then take that piece of paper, put down the numbers 1 through 11, and as I go through these questions, you might want to check them off to see what you end up with. If you feel you have an addiction, it will help you determine where you're at. If you have a friend or a family member who you think might have addiction issues, it will help you get an idea of where they're at, okay? All right. Now, is everybody back? Good. Here we go. I'm going to go through these, and these are the questions and the criterion in the DSM-5 to determine whether or not one has a problem with addiction. When we get done with the 11 questions, I'll show you how to score it, okay? All right, so the definition that they use for substance use disorder is a maladaptive pattern of substance use leading to clinically significant impairment or distress by 2 or more of the following questions occurring anytime in the same 12-month period. Okay? All right. Question number 1. Do you use the substance in larger amounts or for longer periods of time than you intended? So a lot of people start off having a few drinks or using a little bit of drugs, but all of a sudden it starts taking over and they're using it a lot longer than they thought they would, okay, and a lot more often, all right? Or they, stop at the bar at the end of the day. I'm just going to have a drink or two, and they spend the evening. So there's all different ways of looking at this question, but basically you're using the substance in larger amounts or for longer periods of time than you initially intended to. Number 2, you have a desire to cut down or stop the substance but not be able to do so. You'll find, at least in my experience, either personally or with people I've worked with, is that we're always trying to manage it. I'm not going to drink just on the weekends, and I'm going to drink beer instead of wine or whiskey, or I'm just going to smoke marijuana. I'm not going to use hard drugs. But we're trying to control what we do. Okay. Number 3, do you spend a lot of time about obtaining, using, or recovering from the effects of the drug? All right. I mean, it doesn't take long to obtain alcohol, and actually, quite frankly, it doesn't take that long to obtain drugs. But do you spend a lot of time using it and a lot of time, recovering from it, hangovers, stuff like that? Number 4, do you have cravings, urges, and strong desires to use the substance? So now it's starting to, when you don't have the substance, it's starting to bother you, and your brain is going, where's my beer? Okay? Number 5, failure at work, home, or school because of substance use. Getting in the way of your job, getting in the way of school, okay? It's getting in the way of your relationships at home, things that are going on at home, okay? All right. Number 6, continue using even when it does cause problems with relationships. So now you're losing friends, or friends are getting pissed at you. Your family is getting angry, they're getting upset, okay? They're telling you what's going on here. So basically, you're having problems with your relationships. It could be with your boss or teachers, but you're not doing anything about it, okay? You continue using. It doesn't matter. Number 7, you give up important social, occupation, or recreational activity for the substance. You used to have hobbies, but you don't have hobbies anymore. You used to spend time with your family, but you don't, because the drug, the alcohol, is taking over more and more of your time. Number 8, you're using the substance in physically hazardous situations like operating machinery, driving a car, or when you're taking care of children. That's pretty self-explanatory. Number 9, you continue to use despite knowledge that you are having physical, emotional, or psychological problems that are caused by or made worse by the use of the substance. Okay? All right, you hear my throat? That would be what happened because of all the alcohol and the smoking that caused my throat to become cancerous at one time, and went through all kinds of nonsense to fix it. Number 10, need more and more of the substance to get the feelings that you wanted. In other words, you build up a tolerance. You used to get 3 to 6 beers used to be enough, but now you need 12. Okay. You used to smoke a little bit of dope, but now you have to smoke more, whatever. But you're building up a tolerance. You need more of whatever it is to get the same high that you had before. And finally, the following one is you're experiencing withdrawal symptoms. Now, this one is really confusing for some people, because a lot of people feel that withdrawal symptoms have to be severe, like a really bad case of the flu. So you got the sweats, you got diarrhea, you're throwing up, you got the shakes, cold flashes, hot flashes. And that's very severe withdrawal. But withdrawal can also be kind of sneaky. So withdrawal can simply be the opposite effect of whatever drug you happen to use. So if you're using depressants like opiates or alcohol, and you quit abruptly, you'll probably have trouble sleeping right away. If you're using stimulants like cocaine or crack or meth, amphetamines, and you quit abruptly, you're going to crash and probably sleep for 24 hours or even longer. So those are withdrawal symptoms also. Okay? So those are the 11 questions. And here's how you score it. If you answered 0 or 1 of those questions, then your diagnosis would be does not fit criterion for substance use disorder. If you answered 2 or 3 of those questions positively, then your diagnosis would be substance use disorder mild. 4 to 5 would be substance use disorder moderate. And 6 or more, substance use disorder, you're in a deep trouble, okay? Severe, all right? Okay. So that's the system that is used, the questions that are used by professionals when they're trying to determine what level, if any, a person has with addiction, okay? Now, there's another test that you can look up and take, and it's called the MAST test, the Michigan Alcohol Screening Test, MAST test. And there's 22 questions. And when you take that test, you can substitute any other drug for the word alcohol, and it'll give you the same results, okay? Now, what we're going to do at the end of this video is we're going to give you references on where you can look up the DSM-5 information online, and also where you can look up the MAST report online. And we're going to try to give you references, books, articles, so that when you're done with this, if you want to do a little bit more research, you'll be able to find it there. So anyway, that is the definition of addiction, which it is a disease, and those are the questionnaires we use to determine whether or not you might have issues with addiction. Okay, so that's all for today. Next time, we're going to get into some other subjects. We're going to talk about the holistic view of addiction. We're going to talk about the progression of addiction, and continue to go on discussing problems and what the problems are. Once we finish videos about problems, then we're going to start talking about videos that talk about solutions, okay? So that's all I've got for today. I hope you enjoyed it. I hope it helped, and I'll catch you next time. Now, if you like what you've seen and you think it can be helpful, and I believe it can be, I've been helping hundreds of people for years, hit the like button and subscribe, and we'll keep these coming. Thank you.